Good afternoon, everyone. My name is Ross Wallace. I'm a principal at Santis, and welcome to the Santis webinar on Unpacking Ontario's Digital Health Future. I'm joined today by my colleague, Ben King. Next slide, please. Ben is an associate at Santis and anchors much of our work in the digital health and virtual care space. Ben has over a decade of experience within Ontario's digital health system. In his previous role as the Manager of Strategy and Innovation with the Ministry of Health's Digital Health Secretariat, Ben was responsible for the development of the province's overarching digital health strategy. Ben helped to spearhead digital components of the Ontario Health Team Initiative, the establishment of a provincial e-consult service, and the creation of innovative virtual care pilots. He also negotiated provincial funding agreements and addressed policy barriers that were limiting the spread and the impact of technology across the health system. In addition to his work as an associate at Santis, Ben serves as an instructor in the Master of Health Informatics program at the University of Toronto's Institute of Health Policy, Management, and Evaluation. Now a brief word about Santis. For those who are not familiar with us, Santis is a public affairs, strategic advisory, public policy, and marketing and communications consultancy. We work exclusively in the healthcare and life sciences sector. Our goal is threefold. We aim to unlock key insights by our robust understanding of key actors and factors driving decisions and change. Our senior leaders have experience that can help navigate the most complex challenges and leveraging that expertise to do that. And our track record delivers meaningful results and shows the influence we can have on shaping the system around us. Digital health and virtual care is an area that Santis has spent more and more time focusing on, and that concentration has been catalyzed even further by the advent of the COVID-19 pandemic. As we come out of the worst of COVID-19, we thought it was appropriate and timely to take stock of some of the most important trends, dynamics, and developments impacting digital health and virtual care across Ontario. And Ben's going to take a deeper dive into what we've seen, what's happened, how to understand it, and what's likely to happen next. Before I turn the mic over to Ben, I will also call out the fact that Santis's commitment to the digital health space is being further reinforced by the forthcoming addition of a new member to our team. So starting next week, Madeline Cooper will join Santis from her role in working for the Institute for Health System Solutions and Virtual Care at Women's College Hospital. I'm excited for Madeline to join, and Ben and I and the rest of the Santis team will be leveraging her expertise and her ideas to deliver more solutions to more clients working at the intersection of public policy, corporate strategy, and virtual care. So Ben, over to you.
Great. Thank you very much for that introduction, Ross. Thomas, if you don't mind going to the table of contents. So today's presentation will hopefully take, I think, about 20 to 30 minutes. And afterwards, we should hopefully have ample time for some questions and answers. I tend to talk a bit much, so hopefully I won't go too over time, and we'll have the opportunity to have a bit of a dialogue at the end of this. So the structure of today's webinar is first to provide a basic snapshot of what the government's vision is for a digitally enabled healthcare system, which the government calls their Digital First for Health strategy. The second part of the webinar will be a bit of a reflection on the last 15 months and how it is that the COVID-19 pandemic has reshaped that digital health agenda, both in terms of accelerating components of it, but also changing or slowing other parts of it. And the third part of this webinar will be sort of our conjecture, our expectations of what comes next, looking specifically to the next 12 months, and trying to read the tea leaves and understand and help you understand where things are likely to go with digital health in what we strongly suspect, and I strongly suspect, will be a very eventful year in the digital health space. So with that, we'll go to the first section. So the Digital First for Health strategy, if you can go to the next slide, Thomas. This is the government's strategy in a nutshell. There are 5 pillars of it. This was announced in November of 2019, so pre-pandemic. The first pillar of the strategy is to make it possible for Ontarians to see their clinicians through a wider variety of virtual care options. So the vision was to enable patients to have the choice to see providers by video, by phone, through secure messaging, basically patient choice in how they see their doctor, whether it be in person or virtually. The second pillar was enabling individuals to use online appointment booking tools. The third pillar was giving patients greater access to their own records. The fourth pillar was better integrating and improving the tools that frontline clinicians use to deliver care. And the fifth of the pillars was improving the ability to extract data from all these systems and use those for population health, public health management, cost management, and all the other sort of analytic possibilities created by this data. So if you've been following digital health in Ontario for the last 20 or so years, one thing you'll notice from the strategy is that there isn't actually anything new here. Every part of this would have been captured by previous strategies, by the previous government, and the intent of the previous digital health strategies since probably early 2000s was to enable all of these things. What's different though, what's very different is if you look back at strategies before 2018, pillar number 4 really would have gotten 90% of the attention. The idea of creating a provincial electronic health record that integrated tools across clinical systems, that was the focus, and everything else was very secondary. But what's novel about this strategy, what really changes the equation, is that those first 3 pillars are given much more weight. First off, those 3 things would have been encapsulated in a single point before about improving the patient experience. They are instead 3 of the 5 pillars, and this government has been very serious about prioritizing those, with the basic goal being to radically change the retail health experience of Ontarians. The driving principle, the driving force, was that Ontarians should have greater choice in how they interact with the healthcare system. And the model that the government was using was the banking system, which is with banking, if you want to do anything with your bank, you have a wide variety of options for how you want to do that. They are very convenient. If you want to see someone in person, you can readily book an appointment online or just walk in. If you want to sort of look at your history of your bank accounts, you can do that easily. So that kind of convenience and choice was what the government was seeking to emulate with this strategy. So if you have sort of been looking into digital health strategy in the province, this was published a year and a half ago. It's readily available. Nothing on this slide is particularly new, but the challenge has been for a lot of people trying to understand this space is that beyond the announcement of the contents of this slide, there hasn't been a lot of information about what the government is actually doing to further this strategy. I think that the emergence of the pandemic a few months after this strategy was released would explain why that's the case. But basically, this strategy was announced in November 2019. A lot has happened, but it's been less clear to a lot of people what exactly the government has been doing and what they plan to do to actually achieve these 5 objectives. So Thomas, if you can go to the next slide, please. This next slide is our summary of the most important initiatives that the government is undertaking to further their strategy. Obviously, putting together this list requires a bit of a judgment call because there's much more that the government is doing at various levels in the digital health space. But these are the most important, highest impact initiatives that the government is undertaking to further their strategy. So the first of them is for many years, since about 2012, the Ministry and OMA have been negotiating reforms to physician compensation to enable virtual care. In late 2019, for the first time in many years, there was major progress in those negotiations. And then, of course, the COVID pandemic radically accelerated a number of changes in the virtual care space. The second initiative is the establishment of Ontario health teams, and a key part of the OHT model being what the government calls the Digital Health Playbook, which is a series of guidelines, with the model being that they want OHTs to have local flexibility, but they want them to follow provincial guidelines in some way. So OHTs are being given funding for digital initiatives and are being told to use that funding at their discretion, but that they should be consulting the playbook to ensure that the choices they make comply with the province's vision, and that their choices leverage provincial assets like the province's lab repository or hospital information repositories, for instance. The third initiative that the government is undertaking is the establishment of Ontario Health, which of course is a massive transformation across the healthcare system for non-digital components as well. But of course, in creating Ontario Health, there are a huge number of organizations with a large number of digital systems like eHealth Ontario and Cancer Care Ontario that have now been legally consolidated. And over time, their systems will likewise be consolidated, as will their teams and services. The idea being that a lot of health service providers have expressed frustration over the years with having lots of different organizations trying to engage them on a number of different initiatives without much in the way of coordination. And hope is that Ontario Health will enable digital delivery at the provincial level in a far more streamlined fashion that will make it more effective and less costly. The fourth initiative is the creation and imposition of technology standards. And the government's actually doing a large number of things in this space. I won't go into detail because it would take a while, but through a number of different initiatives, they're working to define standards for data interoperability, for clinical best practices, and also trying to improve standards around patient experience. And through various levers, including funding and new legislation, they are hoping to push vendors to actually implement these standards in a meaningful way. The fifth initiative is the procurement of a provincial navigation service to replace Telehealth Ontario. There's been, for a number of years, there have been rumblings of either replacing Telehealth Ontario or reprocuring it in some way. There was a procurement that happened about 5 or 6 years ago that ended up getting canceled before finalization. But this new procurement that began about a year ago is far more expansive. And the idea is to replace or augment Telehealth Ontario with a new digitally enabled front door for the healthcare system that would give individuals who, whether they want to use phone or a mobile app or a website, they'll have a number of ways to interact with this provincial navigation service, and that service would effectively route people to the care that they need, integrating a lot of existing programs in addition to Telehealth Ontario, like Healthcare Connect. So those five are the really key specific initiatives that the government is undertaking as, I would say, the highest priority digital health activities. Underneath that, they're also doing quite a bit of work to reform data and privacy policy and also establish a provincial digital identity. And both of those things are in some ways health specific, but also go beyond the healthcare system to include a kind of government-wide approach to identity and data sharing policy. And those sort of foundational reforms are meant to make everything in this space much easier. If you can go to the next slide, Thomas.
And Ben, maybe just I'll just jump back in for a tiny piece of housekeeping as I look at the fantastic number of participants who've joined this conversation. For folks who are interested in flagging questions that they'd be interested in having Ben and I take a crack at over the course of this conversation, we will hold them until after the formal piece of the conversation. But please feel free to begin dropping them into the Q&A tab at the bottom of your Zoom screen. And we will sort of sift through them and identify some that we think would be of maximum interest to the largest number of folks. So please feel free to flag those, and we'll come to them over the course of the next 45 minutes.
Great, thank you, Ross. So back to the digital health strategy. So I obviously went through in some detail a number of initiatives, and this is basically our mapping of those initiatives to the province's objectives. So what you'll notice from this is a couple things. One is when it comes to the idea of creating more virtual care options and better, more connected tools for frontline providers, the government's doing a lot of different things and trying to really further these two priorities in any number of ways. The other point of interest is when it comes to online appointment booking, patients accessing their own record, and data integration for analytics, there's much less going on at the government level. And really the strategy for those is very reliant on the Ontario Health team and Ontario Health strategies. So for 3 of the government's 5 pillars, there's really a strong alignment with and reliance on sort of broader system level reform, which speaks to the extent to which the Digital First for Health strategy is highly entwined with the government's broader view of healthcare reform and their vision for what the healthcare system ought to be. Thomas, if you can go to the next slide. actually the next one after this. Thank you. So that strategy was a pre-COVID strategy. That was all defined prior to COVID, and obviously did not anticipate the emergence of the pandemic. And as with so much of what's happening in government and our lives, the pandemic caused significant changes across a number of dimensions. So first, when the pandemic began, right before and after lockdown in March of 2020, sorry that the date there is wrong, March 2020, there was a number of very quick measures that the government put in place as an emergency response to COVID-19. And obviously most sort of publicly seen and consequential of those was the establishment of new virtual fee codes, basically telling clinicians, go ahead and provide as much care as is clinically appropriate virtually. We will pay you for it. When these codes were first announced, there was a number of sort of question marks around the codes related to, well, does it apply to this? How does it apply to that? And the government's message at the time was, we will figure it out, provide care virtually, and in the coming months, we will refine the rules and pay you retroactively. So it's a very fast move to, as quickly as possible, get people out of doctors' offices when clinically appropriate. There were a number of other sort of less high profile measures the government put in place related to things like lab results and integrating lab data, but I won't go too much into that. But really the initial response was around funding and pushing virtual care. Throughout the year, last year, there was a range of other digital work that went on that got a little less attention, but were pretty extensive. Through Ontario Health and Ontario Health's regional digital leads, there was a lot of work to fund a range of local and regional initiatives, such as virtual emergency rooms. So a lot of funding went out to a lot of Ontario Health teams and hospitals to do quite a bit of work, and that led to a lot of changes at a more local level. Ontario established the Ontario Health Data Platform, which is a provincial data platform that enables researchers and public health planners to access provincial data more quickly and easily to support COVID response. And then the other actually big activity that I don't have here is last summer, the government very quickly procured an entirely new public health system for the province and deployed that public health system, which is a pretty incredible thing to do in the midst of a pandemic, a very large initiative, which, for anyone who has now interacted with the provincial booking system, you've used that thing that they procured. So a lot happened, a very heavy lift, a very impressive range of things. But in doing all of this work, it required the government to sideline a lot of previous digital priorities. So if you were to look back at the Ontario Health Team proposals, for instance, from 2019, those proposals included a large number of organizations, especially hospitals, saying in the next 1 to 2 years, this is what we intend to do to further our priorities and change care. We want to improve care for frail elderly. We want to improve care for patients with diabetes. They had a lot of ideas, and the government wanted to flow funding to them and push them towards those ideas. And those had to be largely put aside. So as much as a lot has happened in the digital space that government is, I think, rightly quite proud of, doing so required a lot of what was contemplated a year and a half ago has not happened yet. And in hearing from hospital CIOs, for instance, a lot of them are now saying, we're trying to kind of dust off the plans that we put aside 15 months ago and return to those so that we can kind of get back to our more operational priorities. The other thing that changed is in creating that Ontario Health Data Platform, government has enabled the use of provincial data at a scale that at a speed that had never been contemplated before. And that really forced a lot of decisions around data governance and stewardship and created and established various tables to push these issues. So there's been a real acceleration in that space in moving privacy policy forward. So quite a lot has changed. But if you go to slide 11, Thomas, as much as a lot has changed, what's surprising in some ways is that the province's strategy hasn't changed. So, if the government were to sort of re-release the press release announcing their strategy from a year and a half ago, it would still be 95% accurate. The end state vision that the government was working towards a year and a half ago is still largely the same. The things that are most important to the government are largely the same. And so as much as, much in the world has changed in the last year plus, lots has moved forward. What the government is trying to do hasn't changed as much as one might have expected. The other sort of big thing that hasn't changed as much as one might have thought is that as much as COVID was a very sort of all hands on deck system level crisis, fragmentation is still very much the reality for most digital initiatives in Ontario. And I think that applies not just to digital, but we've seen it in the healthcare system writ large. So the province did play a very direct role in procuring the public health system, revising OHIP billing codes, doing public communications. But when it comes to what were hospitals doing, or long-term care homes, or home care providers, or primary care, a lot of those clinicians sort of figured things out themselves and established their own systems and did it their own way. And as much as there was provincial funding and regional leadership, and as much as those things likely reduced fragmentation to some extent, I think the digital response remained a highly local one. And I think the most high profile example of that, which we are all probably now familiar with, is sort of the vaccine rollout, which is, there was a provincial system, but there's also a bunch of regional systems, and a lot of hospitals had their own approach. And in some ways, there are virtues to that approach. You get a lot of innovation, you get a lot of options, but also you get a lot of fragmentation, confusion, frustration, et cetera. And this is only speaking about Ontario. Of course, if you were to think about COVID as a Canadian crisis, the extent to which there was provincial and federal collaboration, there certainly was some. It certainly was meaningful, but I think the reality of last year has served to underscore the extent to which healthcare in Canada is pretty fragmented, and that goes all the way from the federal level down to your local doctor's office. Next slide, Thomas. So where we are now after all that is that the crisis did in some ways accelerate the digital first for health strategy and did move forward a lot of digital initiatives. But the reality is a lot of what was done in moving the digital space forward in the last 15 months was very specific to COVID, and it's unclear whether and to what extent we are much closer to the system the government envisioned 2 years ago than we were 2 years ago. And to take an example of that, the government is prioritizing things like patient access to records and online appointment booking. And in a way, we all have that now, if you count access to COVID test results and COVID vaccine booking. But obviously, that's not what people had mostly envisioned when they were planning for a future healthcare system. And it's unclear whether a year from now, any of those systems will still be in place because they might not actually be all that useful outside of this context. And I think the most significant of those transformations that we're going to be grappling with for some time now is the government did a lot to further virtual care in this province and make virtual care widely available. And I think they should be applauded for the speed and scope of what they did. But the reality is most of that virtual care is phone-based care. And are we satisfied a year from now if the government says we achieved our virtual care targets, oh, but by the way, it's all phone care? Like that's probably not what we were envisioning when we were thinking of a digital future. And I don't want to sort of naysay phone-based care because I think it has a certain role in the healthcare system. But I think there's going to be a lot of tug and pull about whether and to what extent care should be phone-based. And I would not be surprised if in the coming years there's a big issue now with individuals saying, I can't see my doctor, they will only talk to me by phone, and access in this province has gotten worse because of that. So all to say that in the next year, the government is going to be pivoting back to their original digital vision. And that means kind of taking stock and looking at which activities were slowed, how do you get those going again? What elements of the COVID response can we repurpose and use more broadly? Because there are certain things that probably are pretty widely applicable. And then which of the things that we did during COVID should we be winding down or sunsetting in some way? So how do we sort of change that approach or or lessen the extent to which we are using certain solutions. So that gets us to today. So Thomas, if you can go to the next section, please. So where we see things headed. What we see coming up is really three phases of activity. The first being a phase of consultations, in which we see the government using the next few months to undertake a range of negotiations and consultations to basically figure out what do they want to do in the next year. The phase two will then be saying, okay, we talked to a bunch of people, made a bunch of decisions. Now let's actually implement these things. So we expect that in the sort of fall of this year going to next winter, there's going to be an awful lot of new policies and systems and announcements rolled out. And then after that sort of flurry of action, we're expecting early next year there to be a pivot towards the June 2022 election, which is to say the government will take a position that they did an awful lot, at the end of 2021. They had a great deal of success. And now, if you reelect us, look at what we can do even beyond what we've achieved thus far. So that's the high level characterization of how we see things unfurling in the next year. And if you can go to the next slide, Thomas, we'll just dive a little more deeply into each of these. So the first of these phases is the consultation phase, which we see beginning today and proceeding probably for the next 4 to 5 months. This is something which the examples we have here are very digital specific, but I'm actually seeing it across the healthcare system in a lot of ways. The government recently released consultations for home and community care. They sent a outreach to health provider colleges. So there's a lot of consultation happening this summer that we're already seeing coming out. And the digital space specifically, virtual care negotiations are ongoing with key questions related to how do you make these pandemic codes permanent? Do you change them in some way? Is there a need to cap or restrict phone-based care? Do we care? Are we okay with it all being phone-based? And also, do we want to expand virtual care compensation to include things like secure messaging or remote patient monitoring or other more novel forms of virtual care? In the data access and privacy space, we are going to be, I think, full of consultations. The Ministry of Government Consumer Services just a few days ago released a 43-page white paper on the same day that the Ministry of Health hosted a dialogue on data event to speak to the private sector about their thinking around data reform in the coming years. So we see a lot of likely activity happening in the data access and privacy space, which we think will likely be focused on first taking that provincial data platform that has been used for COVID response and trying to make that a permanent fixture of the healthcare system with greater access to data for people, not just for sort of narrow COVID research purposes, but more broadly to support innovation, social and economic growth in the province, and any number of things. There's also likely to be a lot of consultation related to the future of Ontario Health and Ontario Health teams, and also privacy rules related to things like consumer health apps, which are a somewhat unregulated space right now, in which the government has signaled an interest in regulating. Beyond that, the government is likely to finalize a new version of the digital health playbook for Ontario Health teams. They're probably going to wrap up their healthcare navigation service vendor and likely will unveil their plans or thinking around the rollout for that Telehealth Ontario enhancement or replacement. And then they're also are going to be undertaking a procurement for an Ontario Standards of Care program, which will be an organization tasked with developing and rolling out digital tools to provider systems so that providers at primary care or in acute care settings will have sort of clinical best practice and guidelines built right into their systems that they use. So that's the phase one that we see in the coming months, is just a lot of negotiation, procurement activity, consultation to really set the government up for a flurry of activity, which will be phase two on the next slide, please, Thomas. So phase two we see happening primarily in the fall, but also spilling over into the winter. There will likely be a post-pandemic compensation framework for virtual care, which will likely be tied to provincial virtual care standards, which will basically say, these are the rules by which you can be compensated for virtual care, but we also want to restrict the kind of current Wild West in the virtual care space, and encourage or require clinicians to use virtual care technologies that are certified by the province. We expect there, as I said, to be some pretty expansive new regulations and or policies in the data access, use, and privacy space that will be both health specific and government-wide as part of the government's Ontario Onwards strategy. So there will probably be a lot of change in that space, including, I think, the definition of digital rights for Ontarians to try to sort of emulate what the European Union has done with the GDPR in some way, to have a more expansive view of what Ontarians can expect in terms of how any digital company, whether it be health or not, Canadian or not, can manage and use individuals' data. The government is going to be flowing digital funding to Ontario health teams, likely prioritizing the deployment of online appointment booking and patient portal tools. They're going to be trying to launch their replacement or enhancement of Telehealth Ontario. I think the timelines are getting pretty tight on that one already, but that will be the goal. They will be either announcing or launching their provincial approach to digital identity, probably across the government as part of the Ontario Onward strategy, and launching that new standards of care program. So that's a mouthful. I think in the sort of October to January timeframe, there will be sort of outside of COVID, more movement in the digital space than there has been in some time, because this is an awful lot to be squeezing into a very short period of time. But the government is very serious about trying to have the system look very different a year from now than it did when they first came into office. And then if you can go to the next slide, Thomas. And then the final phase, looking into the next winter and spring, will be the government then making commitments for sort of what will come next should they be reelected. And what those look like will really depend on how far they get with the sort of flurry of initiatives in the coming months. So we suspect that some things like replacing Telehealth Ontario or enhancing Telehealth Ontario will be an iterative process in which maybe some features will be rolled out initially, but then over time they'll gradually augment it. And so they may have announcements to say, here's how we're building on the good foundation we've laid. And then second is there may be a number of announcements where they announce sort of change or funding or improvement in spaces where technology investments have historically lagged. So the government has always had a more active role in primary care digital health, for instance, has worked a lot with hospitals in this space, but has not had the same kind of sort of interaction with or support for home care or long-term care, for instance. And so we see there being a good chance that they will talk about making long-term improvements to those sectors with digital investments being a component of it. So that will all probably come out thinking about sort of the next budget next year and election platforms, and they'll be signaling in the spring what the future looks like, assuming some level of, assuming re-election. If you go to the next slide, Thomas. So this is the last slide. This is just some trends we're going to be watching in the coming months to see how all these plans unfold. The first is, of course, COVID-19 has been taking everyone's attention. It's obviously the most important thing that's happening in Ontario's healthcare system, and it will really shape the extent to which the government can refocus on their priority initiatives. Their agenda for the next 6 to 9 months is extremely ambitious, even if you don't include COVID-19. So there's the possibility that COVID-19 will derail a lot of what they are hoping to achieve, or will put it aside. The second is the question of who is doing all this work. Is it the ministry? Is it Ontario Health? Is it Ontario Health teams? Is it hospitals and other health service providers? Throughout COVID, there has been, in some ways, a lot of great collaboration between these organizations, and in other ways, a lot of confusion and seeming arbitrariness in who is doing what. And more recently, I've seen some plans for the government to introduce new programs that will be, for instance, co-managed or co-overseen by the Ministry of Ontario Health, which just raises a lot of red flags about sort of what is Ontario Health's job versus the ministry and how are they delineating these things. It always takes some time for the sort of roles of the province and its agencies and others to sort of shake out. So that's not surprising. But I think because of the pandemic, clarity in that sense is not as far along as it otherwise would have been. And then the last trend we want to watch is the extent to which the government interacts with the private sector and innovators, and whether and to what extent they're serious about that engagement. I think that from everything we've seen, the sort of political side of government has been very serious about wanting to work with the private sector as partners, but the bureaucracy in actually implementing initiatives has been a bit more traditional in prioritizing the more traditionally conceived public healthcare system. And so when we think about upcoming consultations, it will be really interesting and important to see the extent to which the government actually in practice engages the private sector in meaningful dialogue, and whether the government does sort of treat them as partners, or whether, as sometimes happens, consultations really are focused on the sort of inner circle of organizations and people who are seen as being kind of the public side of the healthcare system. And then next slide, Thomas. So just wrapping up, so those are the trends we're going to be watching to see how they unfurl. And I think the point of all of this is we see the next year being a very high impact, high interest time for the digital health space in Ontario. Based on those macro trends, it's possible that there will be an incredible amount of reform in the next year, or it's possible that we will all get sidetracked again by other priorities and sort of other reality intervening. So we think that there's likely to be a lot of change and funding and movement in an abbreviated timeline. I'm going to be watching closely to try to stay on top of what those changes will entail and look like. We see three phases. We see a window of consultation, a window of action, and then a window of longer term commitments and looking to the future. And because so much is in motion, and because so much is being contemplated for the next year, we see there being a lot of room in the next year for stakeholders to meaningfully shape Ontario's digital health landscape. A lot of these things, the sort of endpoint is not set in stone. They could look very different depending on sort of who government talks to and what decisions are made. And that level of uncertainty is very exciting because it means there's a lot of scope for engagement and improvement in this space. And I think with that, I will conclude and pass it over to Ross to moderate the Q&A. Thank you, everybody.
Great, thank you, Ben. Tons of stuff for folks to reflect on, and no surprise at all that we've got three really interesting questions that have already come in through the Q&A tab at the bottom of your Zoom screen. Maybe just before I begin to work through those questions, I'll remind folks that there will be a survey link generated at the end of this webinar, so please stick around long enough to share your feedback on the content we're delivering for you and ways in which Santis can be particularly helpful to the particular challenges you're facing. And also, we will be sharing both the slides that Ben is using to anchor this presentation, as well as a recording of the presentation webinar itself later today. So stay tuned for that for folks who want a second listen or who want to share it across their organizations. So Ben, with that, maybe I'll turn to the questions we've got. And you know, the first one, unsurprisingly, sort of speaks to this notion of Ontario as a province of pilots. And you know, what kind of interest and what kind of processes will there be, or are there, to identify areas where innovation is happening effectively and impactfully at the local level or the regional level, and then how we spread and scale to sort of extend across the province. So what's your sense of how government is going to be looking for examples of impact, and then from a mechanistic standpoint, actually figuring out how something that works well one place can actually work well multiple places?
Yeah, that's an excellent question. And I think, you know, based on the question, I think the person who's asking and most people on the call probably know that this is a classic challenge in Ontario's healthcare system, where there's lots of local success that just sort of stays in one spot, stays small, and scale has always been an issue. I think the government is being very serious about wanting to improve this. And really the answer is they're hoping for and relying on OHTs to be that answer. In hiring Dr. Sasha Bhatia as a new executive at Ontario Health, and in sort of describing what his role was going to be, it was very much about working with OHTs to identify sort of promising evidence-based solutions and working with them to spread and scale. And the government has also talked about an idea of an innovation management approach in which they will fund or support OHTs to evaluate their solutions, and those that are most promising help them scale. So the basic premise is they want OHTs to innovate and develop interesting new local tools, and then they want other OHTs to learn from those and adopt them, and that's the kind of mechanism for scale. But of course, to my point before about fragmentation being so common in the system and being, I think, almost as entrenched as it has been ever before, I think the real challenge is, will the government ever say, you know, hospital OHTA, you have a great solution, OHTB, your solution is not as good, so OHTB, rip up your solution and do what OHTA is doing. That kind of top-down sort of picking of a winner is not something the government has historically done. But the vision, I think, is to say, okay, we're taking an evidence-based approach, and whatever works best in this space, we should be spreading and scaling it through the OHTs as a model. That all gives a lot of weight and responsibility to Ontario Health and the OHTs, but that's the vision for how the government sees this happening better moving forward than it has in the past.
And that's an interesting articulation of sort of the tension between kind of local autonomy and kind of provincial effectiveness or efficiency. So it's something we'll want to watch. You mentioned fragmentation, which is unsurprisingly kind of at the core of the second question that we got. And, you know, seen through one lens, this sort of plethora of consultation mechanisms and planning tables and, you know, opportunities for stakeholders to engage. You know, the optimistic part of me says that's multiple opportunities for folks to shape a system, for perspectives to be shared and included and adapted. The sort of cynic in me says too many opportunities and too many tables and too many processes and procedures means you get worse fragmentation. And in fact, the likelihood of things getting better in a coordinated and integrated way is actually even farther off. Do you have thoughts on sort of how people should take the right conclusions away from just how many different mechanisms there seem to be right now for opinions to be shared?
Yeah, I am less of an optimist in this space. I think it makes the job of interacting with government more challenging. But it also doesn't mean it's hopeless. Like, I think that the fact that there are, I think there are 3 different groups right now that have announced or begun consultations on digital data rights for Ontarians. I think Treasury Board, Government Consumer Services, and Ministry of Health are all separately doing this. It's possible that behind the scenes, this is all very well coordinated, but you know, if they had some plan to make it look fragmented, they've done like that's what it looks like, and that kind of sort of 3-headed consultation is certainly frustrating because you don't know, well, whose opinion about digital data rights is most valid and who's most important to influence. But the answer is, you know, you can't really, you kind of have to accept that that's the reality of the healthcare system and the government. You have to engage with them. You have to encourage them to sort of talk to each other. And the fact that the conversation is happening, the fact that 3 are doing it is better than 0. I'd prefer it if it was just clear who the one lead was. But the fact that there's so much consultation happening, as much as it can be a bit of a headache, I think is indicative of the fact that the government really does want to move a lot in the next year, which is better than simply not doing anything because no one knows whose job it is to do this.
So you're actually more optimistic than you suggested, which is fantastic.
Yeah, so I talked myself into being optimistic.
There you go. Next question is in particularly focused on the community care organization. So frontline, PSWs, nursing, therapy services. And the questioner says, you know, government OHTs continually talk about integration and secure data sharing, but you know, there's a gap between sort of the rhetoric and then how this is going to actually apply or be embedded within that community care sector, the community care organizations. Do you have any thoughts on when we might see some clarity around kind of the details or the processes that will take those kind of lofty ideals and see them embedded in these actual organizations treating folks at home every day?
No, like to be honest, I think that one big challenge that sector has is that it's a real blind spot for the government in a lot of ways. So the government has always been in terms of engagement and funding and strategy, very engaged with what used to be the OACCAC, then became HSSO, is now part of Ontario Health, which is the sort of provincial care coordinator function of home care. So
Mm,
that layer of the home care system and the digital components of that layer have always had a high degree of visibility and engagement. But when it comes to the rest of the home care system, which is like the people who actually go into homes, who work for SPOs, that part has always been off the government's radar. And when you see sort of government strategy or government announcements, the digital health playbook, that blind spot, I haven't seen a lot of movement in addressing that blind spot. So I think there is, thinking about kind of long-term commitments and sort of the long-term vision, it's really an area where government should want to improve, because I think there's lots of scope and potential for that space to really transform, but it doesn't get as much attention as it should. And it's also, as with the pharmacy space and a few others like labs, when you have the province really leaning into this regional OHT model, any space where most of the organizations are province-wide or at least multi-regional, it becomes really challenging to figure out how you fit into their thinking. And so I think government hasn't fully figured out how to address those issues, because I don't think they quite understand the full scope of them. So there's lots
mm.
of room there, I think, to um, recommend or promote um, improvements. But absent kind of engagement from the sector, I think that one has remained a blind spot for a number of years. And I'm saying that as the person who's been the manager of digital health for home care. It was did not the issues we prioritized really were focused on that care coordinator layer.
Thanks for that, Ben. So a very specific last question, and then maybe I'll ask you a broader one myself. But on the specific front, thoughts on the role and placement of TELUS virtual healthcare into the government's plans?
Of TELUS specifically?
Yeah, TELUS virtual healthcare.
So I think I'm going to have a bit of trouble with like the branding. So with TELUS virtual healthcare, there's sort of two things that I think that could be being referred to there. Maybe the individual can clarify. One is their sort of more traditional virtual care platform of like a clinician talks to their patients through video. The other is TELUS has been working with Babylon and has a solution that involves like AI interactions with virtual care, and that's more about individuals interacting with a purely digital kind of clinic. And I think that the province's planning, whether it be for TELUS or more broadly, is they're very focused on enabling that more traditional patient-provider interaction, and are very wary of the extent to which virtual healthcare could further fragment patient care. We sort of forget that 20 years ago, the number one issue in sort of politics in Ontario for healthcare was people not being able to find a family doctor. And there's really a worry about a future in which patients, again, can't find a family doctor because all their doctors will only see them virtually, or they're being kind of redirected to sort of AI-based platforms. In my personal opinion, I think the pandemic has shown that a lot of those fears aren't all that well founded, because the government has been hesitant to just open things up, and they did, and the sky didn't fall. But despite that happening, the government still subsequently went forward with releasing pretty extensive virtual care standards, and I suspect they're going to in some way mandate or enforce those standards in the coming year. So when it comes to tools, that are less traditional in terms of patient-provider interaction. I think they are, not going to like outright ban them or what have you, but there's really going to be a sort of policy push to try to have virtual care strengthen the relationship between patients and providers. And for the question, if I'm misrepresenting what TELUS virtual healthcare sort of functionality entails, please, my apologies for that. It's not a system that I have any sort of particular expertise in, but I think when it comes to the kinds of things they want to promote, it's really virtual care that makes it easier and better for you to interact with your family doctor or your specialist in a more traditional patient-provider relationship.
Well, Ben, you delivered value through your answer. So thanks for that. There's one final question that sort of speaks a little bit to the world outside Ontario. And I think for the purposes of this conversation, we'll sort of keep an Ontario lens on things, but certainly the question of, what happens in other provinces, and is there any sort of opportunity to find successes and innovations that work well in one system and port them over to other systems. And that could be a webinar of its own. So maybe we'll see if we can take the lens beyond Ontario for future conversations. I'll ask you one question myself, Ben, and then we'll wrap this thing up. I'm wondering about the milestones or the indicators or the metrics that folks in government are going to be looking at in terms of assessing the success of all of these different components that you talked about. What do you think your former colleagues are going to be, most focused on in terms of tracking progress or sort of assessing impact or, the fruits of their labors, if you will?
Yeah, that's a great question. I think one of the things I would say this government has been most challenged to do, and this is a pre-COVID statement, is sort of lay down metrics of any sort. I think it was being worked on. I think there was a real desire to sort of have clear, transparent metrics and be accountable to those metrics. But the government's the pillars of their strategy were Ontario Health teams, digital first for health, and supply chain. And prior to COVID, they weren't successful in actually putting stakes in the ground and saying, this is sort of how we're going to measure that. So I think and then of course, COVID sort of changed the equation dramatically, and the metrics we track now are very different, as one of the people who sort of looks at case numbers every day. So I think that's always been a gap. But I think that looking to the sort of next year plus, I think virtual care will continue to be the thing that they track most actively, but it's going to be a very different kind of virtual care, because formerly the most interesting goal was just to increase the number of individuals who have had a virtual care encounter in the past year. That was kind of the key metric for growth of virtual care. But now the goal is actually to try to reduce the amount of virtual care as we emerge from the pandemic, or to use the government's words, to rebalance so that there's a more appropriate balance between virtual and in-person care. And also a goal to have more clinicians go towards using tools that have been certified provincially as compliant with the provincial virtual care standard. So I think that they will have some targets for how to better achieve that balance between in-person and virtual, and some target for sort of uptake of standardized tools. But I'm not sure how publicly reported any of that will be, because I'm not sure how exciting it is to say to people, hey, we're going to, in the next year, go from 70% virtual to 35% virtual. As much as that may be a laudable goal, I don't think it's the kind of thing that is hugely exciting and like a sort of build excitement for healthcare reform sort of way, which then leaves, I think, online appointment booking and patient access to records as probably the most exciting, interesting things that they would triumph or tout. I think between the data access, consultations and initiatives, and funding for patient access to records, I think there's going to be a lot of attention given to defining metrics for and trying to encourage people to have access to their records as something very sort of retail oriented for Ontarians, and also people who can, say, book an appointment with their family doctor online. So I think those are probably the key metrics. And then beyond that, it's more about implementation. Does Ontario, 6 to 12 months from now, have a specific digital identity program government-wide? Is there a new healthcare navigation service or an enhancement to Telehealth Ontario, that sort of new service in place people can sort of see and interact with? Those sort of more initiative-based targets, I think will be in addition to a few metrics around patient experience.
That's great. Thanks, Ben. Fantastic conversation, tons of interesting insights and information, and an engaged and thoughtful audience as seen through the questions that were shared. So on behalf of Ben, on behalf of the entire team at Santis, it's a great pleasure to have offered this webinar on insights and perspectives on the sort of current and future trends and trajectories of virtual care across Ontario. We look forward to engaging with many of you on many different sub-elements of this conversation over the coming months. If you're interested in anything that Ben talked about in greater detail, please feel free to follow up with any of your Santis Health contacts. And please stick around to fill in our survey and share whatever feedback you can. That would be incredibly helpful, and we'd appreciate your thoughts and your perspectives.
Thanks very much, everybody.